Good afternoon. Thank you, everybody. I'm Justin. I'm from Washington, Indiana, county-owned, independent rural hospital. There's a lot of support to maintain independence across the state and continue to lower cost and create that independency that is good for all of our patients across the region. I've heard that you are looking for very specific examples and numbers associated with that. And so at Daviess Community Hospital, Luke had talked about the emergency department. There's no standardized guidelines for facility ED billing codes. Each payer applies its own criteria. And so that is very hard to keep up with, wondering what it is. They submit back to us. They deny it automatically with no reason. There is no reason. It says provide more information. There's a code response of CO16, and it responds to say, give me more information. What information? Just think, right, if you're asking your team to give you some information, but you don't even tell them what it is, pretty hard for them to give you good information, right, and be prepared. So accountability, being transparent. We had another patient just the other day come in with a gunshot wound, and we coded it at what it was a level 5. We stabilized the patient. We had to transfer them out to a higher level of care and automatically down coded to a level 4. Automatically, that was a 20% decline in our reimbursement rate. 20% for a rural hospital when we're already 65, 70% Medicare, Medicaid in rural Indiana. And so just as we partner with other health systems, larger health systems around us to provide services to our community, and for one of those health systems that we partner with, it's about a $10.6 million number that they had in underpayments last year. That's automatic underpayments, things that don't allow you to fight or come back and give responses to. It's an automatic underpayment. For our team at Daviess Community Hospital, our teammates that are working these claims, about 50% of their time is dedicated just to resubmitting and appealing these claims. So you look at that times their rate and their benefits, it's about $250,000 a year for Daviess Community Hospital just in the cost to fight what we already have a contract for and they didn't pay us, and now we're still trying to get our money for the insurance company. So I'll give you a very specific example. In 2023, we had a patient came in, needed an echocardiogram. We did the echocardiogram, billed it out, got paid. Just a couple months ago, in the fall of 2025, they just recouped all of that money. 2025. That service was 2023. Don't think I'm not paying my bills for 2 years and hoping that I keep my money. And for rural hospitals in Indiana and across the nation, we can't wait on paying our bills. We can't wait on paying our people. And so how do we stay open if we're wondering if they're ever going to take our money back? Think of our small businesses in the state of Indiana. Are you going to say it's $50 and then they pay you $50 and then, I hope they don't come back in 2 years and ask me, for $20 back? No, right? You have a contract. This is what you're providing. This is what they pay for. And that's that, right? So we need some standardization around that, especially for rural hospitals, but for all hospitals in Indiana. We are certainly in support of House Bill 1271, and just let's treat each other like it's a business, like it's a regular business, right? We pay for the services. This is the contract rate. Great. We sign those contracts, and that's that. And that's the end of the day. So we ask for your support in this bill in creating standardization so we can continue providing high-quality care in rural Indiana. Thank you.
I appreciate that. I have flashbacks. I thought I was talking to a pharmacist about a PBM, but anyway. Thank you for your testimony.
Don't get me in that.
No. We're not going down there. We only have a handful of minutes here for the last one. Representative Borders, if it's not a bad joke, you're allowed to talk.
It's now. Do you have an obstetrics department there at Daviess County Hospital?
We do. Yes, sir.
I know Linton is struggling. In fact, I think they're actually looking at closing theirs. Is that an area that you're running into more specific problems in the OB section, or maybe the same as every other area? I'm not sure.
So I would say, for OB services in rural Indiana, it is mostly Medicaid. So this bill just addresses, right, the commercial side of it. And so for us, in a lot of rural hospitals, we're 65+% Medicaid, Medicare. Right, so this doesn't even address 2/3 of the issues that we have because this happens in Medicaid too. Concerning, OB services, it's a desert, right? There are a lot of deserts across the United States for OB care. Fortunately, we have partnered with Greene County General Hospital and their CEO, Brenda, in continuing to provide services in and around the area through Daviess Community Hospital. We are assuming their OB provider as well, and we're adding another. We just hired another over New Year's, so we added 2 more providers.
So you will be working with them?
We
in the OB area?
100%. We will.
Okay.
We don't want to put anybody out of business. I understand that in large health systems, right? You gobble everything up, and that kind of is the way it is. We are here to partner with others,
Okay,
whether it's with
appreciate
Greene County, Vincennes, and Good Sam. We are independent hospitals, and to partner together is the way to do it, in
I'd
my
like to
opinion.
get your contact information afterwards. If I
Yes,
could.
sir.
All right,
Happy
thank you.
to.
All right, thank you. Appreciate your testimony.
Yep.